Why should you, as an ENT surgeon, know about MPS or Mucopolysaccharidosis? MPS are rare diseases as defined by the European Union, but altogether they are not that rare. It is probable that you will have a patient with MPS and perhaps you are the first to put the diagnosis. And it would be important to put the diagnosis for the patient and for you. It is important to know before an operation that this patient has an MPS, because a general anesthesia within an extubation is much more critical than in other patients. What is a mucopolysaccharidosis? An MPS is a lysosomal storage disease caused by an inborn lack of a certain enzyme. Glycosaminoglycans cannot be degraded and are therefore stored in different tissues. In the case of MPS II, the Hunter syndrome, only male patients are affected, as it is X-linked. The other forms of MPS are seen in males and females. The first symptoms are often recurrent respiratory infections and recurrent otitis media. Another early symptom is a hernia. If you see a child with chronic infections, ask the parents if a hernia has been operated and look thoroughly to the face of the child. Patients with MPS demonstrate characteristic facial features: thick eyebrows, broad nose, thick lips, and a macroglossia. Later on, patients develop symptoms in different organ systems: a short stature, claw-like hands, joint contractures, and a macrocephaly. The patients show a hepatosplenomegaly, a cardiomyopathy, and dysplastic valves. About half of the patients develop a mental retardation and speech delay. Other symptoms are eye problems, cervical cord compression, and carpal tunnel syndrome. For you as an ENT surgeon, it is important that patients mostly develop a hearing loss. In childhood, typically a conduction hearing loss, later also a sensory neural loss. What should you do if you suspect a patient has MPS? Contact a specialist center to discuss your suspicion. There are easy ways to proceed. Some dry blood spots are all you need for the next step.